Welcome to the Newsmaker. The Global Fund to fight AIDS, tuberculosis and malaria is headquartered right here behind me in the Global Health Campus in Geneva. It aims to step up the fight and end the three epidemics by 2030. The fund mobilizes and invests nearly $4 billion a year to help support health programs around the world, which so far have helped save 27 million lives. I will speak to its executive director, Peter Sands, the former CEO of Standard Chartered, about the huge challenges ahead. Mr. Sands, in January, the Global Fund announced a $14 billion fundraising target to step up the fight against AIDS, tuberculosis and malaria. Are you on track?
We've had a very good start to the replenishment process. We had a preparatory meeting, which was essentially the kickoff in early February in India, at which we laid out the investment case, why it is we need at least $14 billion. And from now until the replenishment conference itself in October in France, we will be working with our donors, both new and existing donors, to raise that money, to gain the pledges, to ensure we have the money we need to get back on track to ending the epidemics of AIDS, TB and malaria.
Now, the fundraising cycle is for 3 years only. How confident are you that you don't need more money than that?
Well, as we said, we need at least $14 billion. We didn't pluck $14 billion out of the air. It's precisely the amount that is required if we're to hit the Global Fund strategy targets, the targets that the board, including the donors, agreed. But clearly, if we were successful in raising more than $14 billion, we could make faster progress in ending the epidemics and saving more lives.
How do you see the willingness of the donor community at this point? Because we have so many challenges in the world, especially the economic slowdown.
I'm never complacent about raising an amount of money as large as this. And of course, there are many competing priorities, budget constraints. On the other hand, we have very strong support from donors, and we have a compelling investment case. With at least $14 billion, we can get back on track towards ending the epidemics. We can save more than 16 million lives. We can halve the annual death toll from the three biggest infectious diseases.
$14 billion could help save 16 million lives, you're saying. These are incredibly huge numbers. How do you actually compute these figures?
Well, the way we do the modeling is we work with our technical partners. It's not just the Global Fund. So with WHO, UNAIDS, Stop TB, Rollback Malaria, and indeed an independent group of modeling experts to look at what interventions are required to reduce infection levels and save lives, and how much that would cost. So this is a big, complicated modeling exercise. It's done bottom up, country by country, disease by disease. Of course, these are estimates. They're not going to be perfectly right, but they're pretty robust numbers.
Now, it seems at this point in time that most money, for example, in philanthropy from billionaires, wealthy individuals, the donor community is flowing into the healthcare sector. Is this not taking away a lot of money from other big issues like climate change, for example?
Actually, I'm not sure that's right. A huge amounts of money are going into climate change as well. Frankly, I don't know the allocation of money across the various different priorities and needs. But the reality is the world has signed up to the Sustainable Development Goals, to achieving a set of specific targets by 2030. And among those targets are ending the epidemics of AIDS, TB and malaria. And in a sense, we are simply saying, if we actually want to be on track towards achieving that outcome, this is what it takes, at least $14 billion.
But still today we have like every second, somebody is dying from an epidemic, for example. Global epidemics still kill millions of people. Every 2 seconds, I believe, a child dies from malaria, for example. Which are some of the root causes at the moment?
Well, these are the three biggest infectious disease killers: AIDS, TB, and malaria. And they are still having an extraordinary impact on communities and individual lives, killing millions of people. We have made huge progress, though, on reducing the death toll. Roughly speaking, we have halved the death toll across the three diseases in the last decade. And we are looking at halving it again, or nearly halving it again, by 2023. So that's a dramatic reduction. But we also need to make progress on reducing the rate of new infections. We've made faster progress on stopping people dying than we have on stopping people getting infected.
On the Sustainable Development Goals, for example, they aim, the goal number 3, to strengthen the health systems around the world and ending the three epidemics that you've just mentioned, malaria and AIDS and tuberculosis. But are we actually going to reach that goal?
We can reach that goal. It is doable. The question is whether we will have the political courage to do so.
Is political will the biggest problem?
Ultimately, political will is the biggest challenge, because political will means that's what you need if you're going to commit resources, either in donor nations or in implementer countries, in the countries most affected by the diseases. And one of the things I should emphasize is that when we talk about wanting at least $14 billion for the Global Fund, we are also saying that we want 46 billion, a much bigger number, from the governments of the countries in which the diseases are actually happening. So actually, our investment case has two asks. It's an ask of the wealthier donor, and it is an ask of the implementer countries themselves.
And the national governments, do you see them willing to contribute more?
We are seeing big step-ups from domestic governments in the countries most affected by the three epidemics. So in the current 3-year cycle of grants, domestic government commitments on spending on the three diseases and on health systems is 44% up on what it was in the previous 3 years. And for the next 3 years, we're asking them to increase by another 48%.
You haven't answered my question, Mr. Sens, on the SDG goal number 3, whether we will reach it or not. So what is your response?
My response is we can reach it. The decision, the choice is ours as to whether or not we make it happen.
And
I would absolutely love to see us reach it, and I think we should.
How far are we from reaching the SDG goal number 3? Very far, or just a tiny bit?
No, we have some considerable gaps to close, and some bits of it are more difficult to reach than others, because there's lots of different elements within SDG 3. The overall goal of SDG 3 is health and well-being for all, which is quite an ambitious goal. But one of the most tangible, concrete achievements within SDG 3 would be to end the epidemics of AIDS, TB, and malaria, and that we can do.
At the WEF in Davos, for example, in January, you got the support from Bill Gates and Bono and other celebrities and politicians and so on. But how do you see the role of the private sector change? Do you get more support now? Can you really rally for this important cause?
We are certainly looking for the private sector to step up. In money terms, we're looking for at least $1 billion in the next replenishment from the private sector.
It doesn't sound like a lot.
Well,
$1 billion from the private sector.
$1 billion might not sound a lot to you, but $1 billion to your average company is quite a bit of money. But it's not just the money we need from the private sector. We need their innovative capabilities, their capacities and skills in everything ranging from financial management to supply chain to marketing. We need all of that from the private sector. And we are getting more involvement and engagement from the private sector.
It still seems, though, to me that it's very fragmented. How to build a stronger network among the health community and the private sector?
I think the health community itself is coming together more and more strongly. Indeed, the fact that a number of health institutions are co-located in this building, the Global Health Campus in Geneva, is a good indication of that. I agree with you that there is more work to be done on how the global health community interacts with the private sector, but the Global Fund is at the forefront of that. Right from the start, the Global Fund was created as a public-private partnership, so it was a mix of public sector and private sector and civil society right from the beginning.
It's a very thin line between cooperation and competition, between healthcare companies, digital companies, private sector companies, and the health community as well. So how can you make sure that it's more cooperation than it is competition?
Well, I think we can do this by being very clear on the goals, by building trusted relationships, by being absolutely transparent and explicit where there are conflicts of interest, and working together. It's in the interests of both the private sector and the rest of society to deal with these epidemics.
To date, the donor community has contributed about 2.7 billion US dollars to the Global Fund. What have you done with this money, and how are you planning to reallocate, all the resources that you are getting?
Well, the private sector has, as you say, made very significant contributions to the Global Fund. It's not made as much contribution as the public sector, but we're looking to the private sector in the next replenishment to make an even bigger proportional step up in terms of contributions. But the importance of the private sector to the Global Fund is more than just the measure of the money. It is the different mindset, the skills they bring, whether it's in data analytics or procurement or supply chain or the reach to customers. So the private sector brings a set of capacities alongside the money it contributes that is a great complement to what we get from public sector donors.
And are you well embedded here in Geneva when it comes to private sector cooperation?
I think the reach of the Global Fund in terms of our private sector partnerships is global. We have partners here in Switzerland, we have partners in the rest of Europe, in the United States, in Africa, in Asia. We are developing more partnerships. I strongly believe we need more private sector partnerships, but we have a very good platform to build on, probably the strongest of any global health institution.
Stay tuned for part 2 of my conversation with Peter Sands tomorrow, when we will talk about Geneva's new role as a global health hub, as well as urgent calls from the health community to prevent quality issues and drug stockouts in countries transitioning away from Global Fund support. See you then. Welcome back to part 2 of the Newsmaker with Peter Sands, Executive Director of the Global Fund, the world's largest financing institution to fight AIDS, tuberculosis and malaria. We talk about Geneva's future as a new global health hub, as well as recent criticism against the fund's funding patterns and withdrawals from countries in need. Some health community and donor members, they have criticized the Global Fund, saying that the nature of the selection process is pretty opaque. What do you respond to this criticism?
Nature of which selection process?
Of projects that you're working on.
The Global Fund process is and has been documented as being one of the most transparent in development. The way projects get selected is there's a mechanism at the country level, often chaired by a country's health minister, that involves civil society, technical partners. They actually, not the Global Fund Secretariat here in Geneva, they actually develop the grant applications. It goes through an independent technical review process. It's a very carefully defined, transparent process by which it's determined where we make investments.
And what about transparency when it comes to funding patterns and withdrawals from certain countries where you were engaged in? Because some NGOs have been criticizing that as well.
Again, most external commentators and most reviews of development and health organizations rank the Global Fund very highly on transparency. And actually, if you go to our website, you'll find an enormous amount of detail about what we're doing in individual countries, how our processes work. I actually think the Global Fund is enormously transparent.
I did, of course, and there's obviously also always room for improvement. So compared to a bank like Standard Chartered, where you were the CEO, how transparent is a company, an organization like the Global Fund?
Well, you can't really make the comparison because in a bank you have an awful lot of issues of client confidentiality, but you also have a lot of shareholder reporting obligations. In the Global Fund, actually, we make probably more information publicly available than any publicly listed private company would do so.
Médecins Sans Frontières in November, for example, issued a statement with regards to the Global Fund, and I'm going to read one of the quotes from that statement. It said, "Hundreds of thousands of people's treatment is at risk as countries transition away from Global Fund support." What's your reaction to that?
The Global Fund has to focus on the places in the world where there is most disease and where the people are poorest. That is our fundamental mission, how we save most lives. And what this means is that as countries reduce their disease burden and get wealthier, we begin to ask them to take on more of the burden themselves. So we ask the countries to transition in a very planned way, with governments taking more of the responsibility to financing the programs. And that enables the Global Fund to focus its resources on the places where there are most people affected by disease and where there are least resources. Some governments manage this transition better than others. We work with them and we seek to support them, but some do it better than others.
MSF, for example, says that this leaves a huge gap behind in terms of treatments and drugs as well, so-called drug stock outs, and also quality issues, people having, a break in their treatments and so on. Is this not creating huge problems, and how are you planning to address those?
There are some transition issues. Most of the problems are a result of and are under the control of actually the governments in the countries. There are opportunities for them to use, say, for TB drugs. They can use the Global Drug Facility, which is the resource that the Global Fund is using to provide drugs. They can be used for the governments. That can ensure a quality supply. So actually, the primary responsibility for ensuring continuities of supply of affordable, high-quality drugs rests with the governments in the countries that are transitioning. We work with them to try and enable them to make sure that that happens, but ultimately the responsibility is with those governments.
That's a very important point. The responsibility still is with the national governments, and it's also a very difficult judgment call to leave a country, isn't it?
Yeah, and we don't do so very often, and we don't do so very quickly, and we do so in a very structured, planned way with careful transition readiness assessments and even transition funding we provide to help countries do this. But ultimately, the test of a successful transition is whether a government is prepared to take responsibility, including the resourcing, of the programs that need to be delivered.
So this means that you would not leave a country unless it's ready to take over the responsibility.
We will push countries to get us ready, but we have to continue to transition countries, because the only way we can provide enough resource, and there are many more millions of people in much more severe need in the poorest countries in the world, the only way we can target resource on those places is by encouraging the wealthier countries to transition.
What is your commitment in terms of time frame usually? Is it a long-term commitment, 20, 30 years or even longer? Or in terms of time period, how long would it be on average?
I don't think you can really frame it like that. The Global Fund has only been in existence since 2002, and actually our target is to do ourselves out of a job by 2030, because if we have achieved the objective of ending the epidemics of AIDS, TB and malaria, you won't need a global fund. So we don't have a set time frame for interacting with countries in mind. What we're looking at is how big a disease burden, how many people are affected by disease, and also can the country afford to do this by itself? Because if a country can afford to resource it by itself, then the resources of the Global Fund should be directed at those who are most in need.
It's a very interesting assumption, Mr. Sen. So if in 2030 there is no Global Fund anymore, no need for you guys, what are you going to do then with this institution? There will be new epidemics and killer viruses, who knows?
Look, I think that would be a fantastic problem to have. But if we can do ourselves out of a job, I think that's an achievement that anyone involved in the Global Fund would be absolutely thrilled about. Because to take the 3 biggest infectious diseases in the world, you know, the world's worst epidemic in the 20th and 21st century, HIV/AIDS, the disease that has killed more people than any other in human history, malaria, the disease that is killing more people than any other right now, TB, if we can get rid of those, then we would be happy to not have a job anymore.
It's a dream come true on that side, but is it not true that if the big 3 epidemics, they disappear, new ones will arise?
It may be the case, but that we see new diseases, but actually the capabilities and infrastructure we're putting in, whether it's community health workers, primary healthcare facilities, diagnostic laboratories, many of these are capabilities that don't just fight AIDS, TB and malaria, but are helpful in fighting all sorts of other health threats.
Talking about the big 3, how do you see Switzerland's role in stepping up the fight against those epidemics?
Well, Switzerland has been a strong contributor to the Global Fund from the start, both in financial terms, but also as the host of the Global Fund Secretariat here in Geneva.
Actually, Geneva is really increasing its role in the healthcare world as well. I mean, you have the Global Health Campus here, WHO, UNAIDS, everybody around. How do you see the future of Geneva as a healthcare hub?
Well, Geneva really is already the center of the global health community with all the institutions you mentioned here. And I think the creation of the Global Health Campus, which has Gavi, UNITAID, the Global Fund, Stop TB, Rollback Malaria, all in one new modern building, purpose-built building, I think is a real step forward in terms of Geneva's positioning as the leading place for global health.
So explain to me how the Global Fund actually decided to set up its headquarters here in Geneva.
Well, you're asking me a question I don't know the answer to because it was, of course, back in 2002. But I suspect the Global Fund, actually, the Global Fund was originally set up underneath the auspices of the WHO. And so it originally made sense for it to be here in Geneva, and then it was spun out and the separate organization was created.
So how do you work here in Geneva with other big health players like the WHO and UN organizations and others like Gavi, for example, here at the Global Health Campus?
Well, one of the things I've been committed to since arriving just about a year ago is to deepen our collaboration with our partners in the global health community. WHO is obviously an absolutely critical partner, and actually we've signed a new framework agreement detailing exactly how we work with the different elements of WHO. Dr. Tedros and I did that back in October. With Gavi, the Vaccine Alliance, we have a particularly close relationship. We share administrative functions here in the Global Health Function campus, but we also work together on strategy, on advocacy, and on the field on doing integrated programming. So when we're dealing, for example, with newly born children, we will be providing treatment for prevention of mother-to-child transmission of HIV. Gavi will be providing the vaccination program. So we will work together on many kind of specific aspects of in-country programming.
And how do you see the future of Geneva as a health capital, and what kind of competition could the city get from other places in the world?
Well, I think Geneva is very much the natural hub for the multilateral institutions of health, be it WHO, Global Fund, Gavi, UNITAID, UNAIDS, and so on. Of course, there are other important centers, whether driven because of big bilateral programs such as Washington, where you have PEPFAR and the Presidential Malaria Initiative. In Germany, you have just had a new global health hub announced in Berlin. So you'll see different centers. But I think that's actually quite good to have a bit of sort of competition and a bit of stimulus from different parts of the world.
Before we go, Mr. Sands, you were the former CEO of Standard Chartered, one of the biggest banks in the world, of course. What kind of lessons that you've learned did you bring to the Global Fund, and how is this shaping the work that you're doing?
Well, obviously, this is a very different role, running the Global Fund.
Is it more purposeful, would you say?
Obviously, you can get very excited about a job where you save millions of lives. And there's nothing better in terms of delivering. In terms of things that I brought to it, I would say one of the things that I'm particularly focused on is an obsession with having very frequent and granular data that enables us to target our interventions very specifically. It enables us to know very quickly when things are going well and then to scale them up, or when things are going badly and stop them. And in the world of global health, the cycle time and granularity of data is much less mature than it is in the world of financial services. So I think we've got quite a way to go to get to anything like the way the world of financial services work.
Does this mean that we will see much more big data and blockchain in the Global Fund as well?
Well, I'm not sure about blockchain, because blockchain is often a solution looking for a problem. But certainly we are investing heavily in ways of gathering, analyzing, interpreting data to enable us to make faster, better decisions. And we will definitely continue in that direction.
Thank you so much for your time, Mr. Sands.
Thank you very much.